for testing. And those priority groups are healthcare workers, those residents and staff of long-term care facilities, those individuals who are hospitalized or likely to be hospitalized, as well as individuals who are associated with outbreaks or clusters. So potentially a group that might be associated with a previous mass gathering. And we have conducted hundreds of tests here in the interior region. And we do have 10 assessment and testing facilities in the interior region. And individuals are referred there by 811 or by their healthcare provider.
Now, could you just talk a little briefly about the difference between the different health authorities? Is there a difference when it comes to testing? Or is it something that is directed by the larger Ministry of Health or the Chief Medical Officer?
Mm-hmm. So the Chief Medical Health Officers for the health authorities do meet regularly with the BC Centre for Disease Control and with Dr. Bonnie Henry, and we do discuss issues like testing strategies. And so here in BC, we do have a coordinated testing strategy with a focus on those four high-risk groups.
Okay, thank you. So the next question I have is, I am an individual and I'm very worried about asymptomatic individuals still heading out within our community and aiding in the spread of COVID-19. If our community is not testing, unless all symptoms are present, then how can you have a clear understanding of the true impact of the spread of the virus and the quarantine requirements, in this case, in the caribou?
Mm-hmm. So at present, we are recommending that anybody who in our interior region, anybody who has mild respiratory symptoms should be staying home and self-isolating for 10 days. So for those community members who are not fitting into those 4 priority groups for testing, our advice would not change whether they had a positive COVID test or no test at all. And so it's very clear that we need those individuals to stay at home and to stay at home until their symptoms are better and until 10 days from symptom onset.
Now, there's all kinds of information on the internet, of course, some of it's even true. When it comes to testing, a little pen that you can use now and pick your finger and boom, you have an instant result when it comes to COVID-19. Obviously, that's completely different than what you're using because it takes a few days for you to get the results. What's the difference? What are they doing with these inexpensive, almost instant tests?
Well, I can speak to what we're doing here in the interior region in BC. So we are very fortunate in the interior region that we have our lab here at Kelowna General Hospital up and running and able to do testing here. Initially, when this outbreak began and then turning into a pandemic, we were sending our samples to the BC Centre for Disease Control Provincial Laboratory to get test results. And so our turnaround time would be a few days during that phase of this outbreak. But now that we have testing here up and going at KGH, we have a very rapid turnaround time, sometimes as quick as 24 hours. We can get results back to people very quickly. And if it's a COVID positive patient, then we can initiate case management and contact follow-up very quickly.
Okay, thank you, Dr. Pollock. Next question I have here is, right now I am in self-quarantine because of attending Save On Pharmacy in Kamloops. Fortunately, IHA released an alert. Someone else asked why officials will not tell us the specific numbers and locations of COVID-19 cases that there are in each of our communities for our safety, the option to choose between a shop in Fernie versus Sparwood versus Cranbrook, Kimberley, or Creston, they're saying should be theirs. And I have to say that of all the questions that we received, that's probably the one that received the most similar kinds of questions is, why can't people know where the outbreaks are occurring?
So it's a great question, and we have followed the direction of our provincial medical health officer around not to disclose where positive cases are in different communities. And that strategy has paid off well for British Columbia. We need people to feel safe, to be able to come forward and be tested. Right now, BC has tested more people in our province than the whole of Ontario, and we have a third of the size of the population. So I think the strategy is paying off. People feel safe to come forward. And bottom line is, it really doesn't matter where people are. We don't want people assuming where positive cases are. They could be anywhere. We need to have a high degree of diligence around the different messages that we've been given by our medical health officers. We need to be social distancing. we need to be doing self-isolation when that's appropriate.
I understand that healthcare staff are not being informed of confirmed cases, at least that's what this writer says, of COVID-19 in their own communities. Does it not make sense to provide them with that information so they can plan to see where the waves are going to be in the region? And this was somebody from Williams Lake.
Healthcare providers, if they're actually caring for somebody who is positive, they would know that, obviously to protect themselves and the other patients around them. So, but it's not openly disclosed in the community for the reasons we just discussed.
Okay, thank you, Susan Brown. I'm an employee with Interior Health in the East Kootenays, at the East Kootenay Regional Hospital. I'm wondering if there is a known positive case at the hospital. I don't know if you'll be able to tell us here, but if there is one, will I be informed of this regardless of whether or not the patient comes to my specific department or not? So very similar to the last question.
When I think back to my own practice years ago, and now we have universal precautions in the hospitals for good reason. Until you know differently, you assume. So right now, our healthcare providers have been given appropriate direction on how to protect themselves and others. And we would not be going around all the different units telling somebody who's positive. If they're actually involved in the care, they would know.
The last question on this particular section from the emails we got, and we'll go to the live questions and answers in a few minutes. Can we also find out how many cases of those under 5 have COVID and how serious it is for this age group, 5 years of age? I have a 3-year-old and a 1-year-old, and I'm very concerned. So a very concerned parent. What can we do to help?
Well, I can speak to our BC statistics. And so in those under age 19, it's a very, very small proportion of our cases. We know that fortunately, this is a group that seems to be less affected by the virus, certainly in terms of any severity of disease. And of course, we know that in other illnesses like influenza, children can be very, very adversely affected. So it's a very small proportion, but of course, we want children and their parents to take the same precautions that everyone is taking to ensure that we can protect ourselves against this virus. Okay,
thank you. All right, so we're going to switch now, for now anyway, to the prevention topic. These are, some of these are short snappers, so feel free to say yes or no if that works. How long after symptoms abatement is a person no longer contagious? This is from someone in Castlegar.
So for purposes of those who have mild illness, we consider their period of infectivity or communicability to start when their symptoms first appear. And we consider that period to continue until 10 days after symptom onset, provided that they are feeling better, that they have no fever. They may have a bit of a persistent cough, but otherwise they should be feeling 100% better at 10 days in order to consider that they're not infectious anymore.
Okay, thank you, Dr. Pollack. Are there any other precautions we should be taking in order to protect our loved ones besides washing our hands and social distancing?
Well, those are two very important ones. I'm going to speak about it many times tonight. And so we can call it social distancing, we can call it physical distancing, because we still want people to have that social connectivity. But the physical distancing is really about keeping 2 meters or 6 feet apart from other people. And that needs to happen everywhere we go. And that's a really key point to getting a hold of what's happening with this virus. The other things, of course, are hand hygiene. We hear lots about that. And teaching our kids how to properly wash their hands. I know that my kids, I've had to sort of train them to do the 20 second of hand washing and get all the surfaces. So it's something that we all need to work on in terms of practicing good hand hygiene. And of course, staying home when we're sick. And so that is so important. We know that most people now, and we hope, are staying home. Hopefully working from home, staying home, maybe just going out for essential services. But certainly if you are unwell, even if you just have a runny nose, you need to be staying home.
Thank you. Do you believe using gloves prevents the transmission or augments it?
This is an interesting one because there's lots of people out there wearing gloves. But if you're just wearing gloves and going around your usual day-to-day business, you're actually just using gloves to touch everything. So it doesn't really make any difference. If you're using gloves for something very specific and then you take them off safely and discard them, like if you're providing care for somebody, then that's very appropriate. But really, soap and water and washing your hands is the best way to prevent the spread of anything.
Thank you. So for those of you who have just joined us, we've been on now just for about 14 minutes. Thank you. We have Susan Brown, the CEO and the president of IHA, and Dr. Sue Pollock, who's the chief medical officer for IHA. And they've so kindly come on tonight to answer your questions. We've had over 1,000 people register for this event. So this is obviously the one that's attracted the most attention. And we've had people from all over IH, from the United States border to the Alberta border to the border with the north of our province, and of course in the middle of the Thompson Okanagan as well. So welcome to all of you, and thank you to all the, I'm just putting a mouse on my computer. There we go. Thank you to all of you for sending in your questions ahead of time and for giving us questions on the live box. Please continue to do that. We'll get to those in just a few minutes. Home care workers are going into numerous homes of the most vulnerable people without the proper cleaning supplies or PPE. Is this acceptable?
Thanks for that. So our home support workers, of course, do care for a lot of seniors and other people who can't get out of their houses. So having the right protective equipment for them is critical because they are frontline and they do have that protective equipment now. And we are at every moment making sure that if anybody's ever in a car with somebody else, there's appropriate distance apart and there's appropriate cleaning of the vehicles. So they are protected now.
Okay, thank you. Should the immunocompromised and people with type 1 diabetes at any stage stay home and away from work if possible?
So we talked a little bit about children already, and I'll talk now about those who are more severely affected. And so we do know that about 80% of people who develop the novel coronavirus, so COVID-19, do have relatively mild illness and mild symptoms. But there is a proportion of people who develop more severe illness, and some requiring hospitalization and even ICU care. And so those individuals who are more affected by COVID-19 tend to be those who are elderly, and also some people who have underlying health conditions such as diabetes or cardiovascular disease or high blood pressure. And so the same requirements and recommendations apply to those individuals as to everybody, which is really right now the most important thing you can do is to stay home, to physically distance yourself from others, and we all need to do our part.
How long does the virus survive in surfaces? This is another one. We got a lot of questions similar to this one. How long does the virus survive in surfaces outside and inside, in vehicles, cloths, doorknobs, plastics? Will it die if left outside overnight? So that's the theme. Any advice you can give to all of us so we can better prevent getting the virus?
Yeah, that's a really interesting question. And I've heard that come up a few times over the last number of weeks. And I think it can be hours to a day or two. And I think it really depends on the surface. So my understanding more anecdotally is that on paper, maybe it doesn't live as long versus being on a smooth surface like plastic or metal. And so a couple of things we can do, knowing that the virus can survive for hours or up to a day or two, is to ensure that we are regularly cleaning surfaces that we're in contact with and that our family members are in contact with. So we can do that at home, or if we are going into work, if we're in that essential work category, doing that at work. And that cleaning will be really important, and just keeping our hands washed regularly.
So if I'm going to my mailbox to get my mail, should I be touching it with tweezers and not, that kind of thing? When I go to the grocery store, should I be making sure I wear gloves and put everything in the cart and leave it in the garage for 2 or 3 days to make sure the virus is gone? Like these kind of practical things that we do on a day-to-day basis.
Yeah, that's a good point. And again, I think anytime that we're going outside, whether we're going out to touch the mailbox or we're going to the grocery store, the first thing we do when we come home is to clean our hands for 20 seconds. But certainly people are employing all kinds of different methods, using their sleeve to open things. And so certainly people can wipe down the groceries or wash their produce with water when they get home. We do that anyways. But the most important thing is hand washing.
Okay. What are we expected to do after 14-day self-isolation? Some of my friends are under the impression that once they've stayed safe, we are free to go about our normal routines. Surely we are to remain in a state of social distancing for quite a while yet, as the disease will still be running through our province.
So I'll speak about that 14-day period. So we've heard about that 14-day period for people who've returned, travelers who've returned from outside of Canada, have been requested and now are being required under the Quarantine Act to stay at home and self-isolate for 14 days. That is because that is the incubation period for novel coronavirus, at least the outer limit of the incubation period. And so that's to ensure that symptoms are not developing during that time period. So if somebody has come back to Canada or has been requested to self-isolate for 14 days, once they clear that 14-day period, if they have not developed symptoms, then they're okay to resume their activities.
Okay. And later on, maybe, if I remember correctly, it's in there, but I'll ask it now. So you talked about coming in from outside the country. Right now, there's nothing stopping people from coming in from other provinces. A lot of the people in the Kootenays and other parts of the Shuswap and others see a lot of Albertans coming in, and they're concerned that they're not doing the same kind of things that British Columbians have been asked to do. What would you say to them?
Mm-hmm. So I have been following a little bit in what's happening in Alberta, and I know that their provincial health officer, very similar to Dr. Bonnie Henry here, our provincial health officer is providing the same guidance to people, which is that need to physically distance and self-isolate if you're symptomatic, and monitor for symptoms if you've been exposed to something. So that would apply to whether you're coming from Alberta or you're coming from the Kootenays to Kelowna.
So what if someone sees people that are assembling in groups against what Dr. Henry has mandated, or doing, breaking some other of the rules and the laws? What do you tell them to do? Are they supposed to call bylaw officer, a local municipal bylaw officer? Are they supposed to call Emergency Management BC? Who are they supposed to report to? Obviously, we don't want people to go and start giving, heck to others, because that can turn into a pretty violent situation pretty quickly, right? So what do you recommend they do?
Yeah, so just a reminder to everybody that this isn't optional in terms of avoiding, mass gatherings or large gatherings, that people have been required to not do that by the provincial health officer order. But I appreciate that people out there may want to help, right? And if they see people gathering in big groups, they may want to speak out. So a couple of things. One, we have our local environmental health officers for interior health who work with restaurants and nightclubs and bars and gyms and other facilities to ensure that they are adhering to the order. And there is some guidance coming out as well that will help us to know how we will work with bylaw officers and our CMP as well.
So that'll be posted on the IHA website, or is that going to be province-wide, or where is that going to be?
That will be province-wide guidance that will help us as interior health, our environmental health office, for example, work with those authorities to help enforce.
All right, thank you, Dr. Pollock. Is a person who tests positive for COVID-19, if they remain asymptomatic, are they a potential carrier forever? For how long?
Mm-hmm. Well, it's a very new virus for all of us. We've only known about COVID-19 since December. There have been reports of asymptomatic infection, but we don't. We're still learning what that means in terms of the role it plays in transmission. And we know that the bulk of our cases and the numbers we're seeing in the COVID pandemic are due to symptomatic individuals.
Okay. Now, some of our citizens are seniors, and they might not be as connected as others. Is there a way for them to get information that's not on the internet or not on their daily TV news?
Yeah, our case managers are going through a lot of their different files to identify people who may need a little bit of extra support. They are reaching out, phoning seniors that may be isolated at home, making sure they have access to their medications and arranging that if it's not possible for them to do that. There's also some community clients that may have disabilities or brain injuries, and making sure that they have what they need. And also we have a number of clients that have choices for their own independent living, and making sure they can have access to supplies that they need to carry on. And in the instance that those clients, their caregivers not available to them, we are looking at retired registered nurses who may come back and want to do some work. And then working with a partner, BC Community Living is doing some telehealth and outreach to some group homes, either through nurses or some other health professionals that can offer assistance.
Okay, thank you, Susan. Do the latest quarantine orders for people returning from international travel apply to those that are partway through their isolation orders?
So my understanding from the federal quarantine orders is that they apply for people who've returned as of the date of that order, which I believe is March 25th. So that's when the piece around enforcement would come into place, which could be fines or even jail time under that Federal Quarantine Act. But here in BC, we have had that requirement to self-isolate after returning from travel outside Canada for a few weeks now. That came out from our provincial health office.
Okay, so short answer is stay isolated, right?
For the 14 days.
For 14 days. Someone was asking about clothing stores. You know, people put on clothing, take it off, and is that a concern at all?
We know that many of our businesses, which would be deemed non-essential, have closed.
Right.
I speak from being here in Kelowna and walking around in the area. Some have decided to remain open, but there are requirements for those businesses that if they're to remain open, they need to limit the number of people in the store, as an example, to ensure they have that 2-meter distance between people. I know that some stores are going to offering, you know, call me if you want to come and window shop, we'll let you in. So I think as long as those measures are being taken in businesses like that, the physical distancing, maybe having some hand sanitizer available, will be a good thing.
All right, thank you. Another question that came in was regarding the seasonal agricultural worker program. Many of our farmers, of course, throughout the interior rely on these wonderful people that come in and work our fields. Are we to be concerned at all that they're going to be housed in bunkhouses in some cases, that they might be on a work site where they might have 40 or more workers in one place? And what are we going to do to make sure that they are not going to spread any of the virus to themselves, of course, that they're safe, and to the general population?
So for those seasonal workers who are coming, if they're coming in from outside Canada, then they would need to be following the quarantine order of self-isolation. Once they've been here for a couple of weeks, and if they're living in close quarters, of course, we'd be requiring through their employers that they're monitoring for any signs of respiratory illness. If we did have a situation where we had respiratory illness in, say, a work camp or in a industrial mine camp or something like that, we would certainly investigate that as a cluster outbreak. That would be a group that we prioritize for testing. And we would work with the employer, we work with the ministry as well to ensure that we were able to safely isolate those individuals who had respiratory illness. Okay,
thank you. Would it be prudent to start having people sew face masks, as there seems to be a shortage of masks?
I see a lot of people outside with different type of face masks on that could be handmade. It wouldn't be appropriate for healthcare providers, but if people felt safer wearing masks outside, there's no reason why they shouldn't. But I have noticed quite a few people touch their face more when they have masks on, which isn't helpful. So if they're wearing a mask, they have to be conscious of that, and then again be washing their hands a lot.
Thank you, Susan. So we are about 1/3 of the way through this. So for those of you who are watching, 30 minutes, thank you. If you are watching on a live stream, in other words, you didn't register and you're not on the internet piece, then you can't ask any questions through our Q&A. So if you want to ask questions, the box says to ask questions live, register now at www.teamokanagan.com. So please, if you want to put a question to these two wonderful panelists, please do it that way. Otherwise, you can continue watching on whichever way you're doing it, YouTube or Facebook or Castanet or any other number of devices, and just watch. And what will happen after tonight is we'll generate a transcript of this complete conversation, especially for those people who are hearing impaired, who can then read what the questions and answers are. And we'll also send any questions that we haven't been able to answer tonight over to IH, and they will put together some form of common Q&A over the next week or so that we can address as many of your questions as possible. Because obviously in the hour we have left, we won't get to all the questions, but we'll do our best. If someone has a child who was tested positive and needs hospital care, would they be admitted alone, or would a family member be allowed to be there with them in quarantine?
So we have tried to limit the amount of traffic in and out of any of our facilities, hospitals, long-term care, and that's really for the safety of the people having care there. If it was a child, we would do everything we could to have a mum or a dad there, or both. And also, you know, if it's palliative or other compassionate reasons, of course, we would make sure that happened.
Okay, well, let's hope it never is, right? Let's hope it never is. I'm thinking of my grandchildren right now. My question is, when all of Canada is my question is, when all Canada is keeping, hard to understand this one. Let me rephrase it the way I can. How do taxi drivers keep safe? That's fundamentally the question that's being asked. How do taxi drivers keep safe?
So I guess it's keeping taxi drivers safe as well as their passengers.
Yes.
So
how do we do that?
Again, we expect all employers who are remaining open, and that is very well, it could be considered an essential service, to ensure that they are adhering to the physical distancing. So if somebody is getting into a taxi cab, I would hope they're not getting in ill or with respiratory symptoms. So that's incumbent on the member of the public to not be getting in a taxi cab with respiratory symptoms. Recommend they not sit right next to the taxi driver. And then for the taxi driver and the business, that they should be regularly cleaning the taxi.
Mm-hmm.
That virus can, as we've talked about, that virus can remain on surfaces, and for example, in a car on a vinyl surface. And so regular cleaning of the taxi.
Right. And as you can see, I just touched my face, and like everybody else, I'm trying not to, but it's hard, isn't it? But we're not mandating that all taxi drivers put up a plastic barrier between the front seat and the back seat, correct?
I mean, some taxi drivers may already have that in place, and that certainly could help with protection.
Okay. There were a couple of employees who sat within 6 feet all day of someone later found to have the virus. The rest of us shared lunchrooms, kitchen, file rooms, and a bathroom with her. In this circumstance, should all employees be self-isolating, or is only self-monitoring enough?
Mm-hmm. So it's a good opportunity for me to speak about the work we've been doing here in public health within Interior Health to follow up the cases of novel coronavirus, of COVID-19. And so any confirmed case of COVID-19 is immediately reported by the laboratory to the medical health officer. And the medical health officer then, with our team of amazing communicable disease specialists, then follow-ups immediately with that individual who's a case. Sometimes we already know about them. We may already maybe have them on our radar, or have asked them to self-isolate. But we immediately follow up with them, and we find out where they've been during their infectious period. So again, we talked about what the duration of their symptoms. We find out where they've been, who they've been with, and then we initiate something called contact tracing. And so we actually get the names of the individuals that they have been in contact with. Sometimes it's just their household members. Sometimes it's much broader than that. And then we follow up with those individuals. We assess whether they have any symptoms or not, and then we provide recommendations to them as to what actions they need to take.
So you're following a plan that's been in place for a long time and adjusted. I know the Spanish influenza, for example, 102 years ago, they had a plan at that point too. Obviously, it wasn't the best plan in the world, and there was a lot of conflict as to whether or not one approach was better than another. But over time, we continue to have these plans that are put in place. Did the province have an opportunity to test these plans over time? Like, did you do a little trial run, improvised kind of thing, so that this is not just, here we go, we've never seen this before? I assume this is your expertise, right?
Mm-hmm. Yeah, this is definitely our specialty, and I'd say the bread and butter of public health. And so this is a well-tested strategy for managing cases and following up their contacts. We do this with other diseases like tuberculosis. We do that with measles when we do see measles, other diseases like mumps. And so this was just a matter of coming together as a public health community to adapt well-proven strategies for doing contact follow-up of individuals.
Right, okay. We're surrounded here by snowbirds returning from outside British Columbia. They know they are required to do a 14-day quarantine, but don't seem to understand that they are subject to a different set of rules in their shopping, using post offices, going for walks and drives. I assume from what you said before that this is inappropriate. They should be going straight home and self-isolating. Is that correct?
And I've heard very, very clearly from what I've read and from the media that that message is out there. That snowbirds who are returning from the US, maybe they've been there for a while, they're coming back in their trailers, are to immediately go home, not to stop at RV parks, not to stop for groceries, immediately go home and do the 14 days of self-isolation.
Okay. Someone would kindly request that IH review its current policy regarding doulas and support people in the delivery room. This lady is expecting her first child in May and would anticipate that the policies in place at RIH, so I imagine that's Royal Inland up in Kamloops, due to the COVID-19 crisis will likely still be in place when her baby is born. So is there a policy that would prevent her from having a doulas with her?
So just coming back to that previous comment about reducing traffic, but I hadn't actually heard that doulas had been asked not to participate. That is something that we would look at because of course they've been part of the birth plan all the way along. So we'd be expecting that doulas would be totally reasonable to be part of the birthing process.
Okay, I'm sure you'll make her feel a lot more comfortable. Thank you for that. My cousin is a GP in Kelowna. Well, finally a question from Kelowna. We've done everybody else around the province. Has not been able to get access to masks and other medical supplies. What is the government doing to address this specific issue?
So normally GPs order their own supplies through their usual vendors, but appreciating that the circumstances may have changed, we're working with closely with Dr. Graham Dodd, who works closely with all the 8 divisions of family practice across the interior region. And he's in close contact with us. If anybody does get into that situation and requires supplies, just get in touch with him and we'll address the situation. However, a lot of GPs have actually shifted their practice to virtual, and of course that is diminishing the demand. So perhaps not as much of pressure on them to have more supplies, but if they're in need, we will work with them.
Yeah, I'm a big supporter of virtual as well. So we'll see what happens after this crisis is over if we continue with that option. I'd like to see it. Do you, so these are in the general category now. Do you, the experts, have any idea when the virus infections will reach its peak?
Well, we are, as of today, we're at 70 cases here in Interior Health. And of course, we're watching that very closely day to day. And in terms of when the virus may reach its peak, we watch something called an epidemic curve, which is a graph where we chart the number of cases over time. And so we expect more cases, absolutely. And depending, the course of this outbreak will really be dependent on how well we as a society implement and adhere to the recommendations and the orders and requirements of our provincial health officers. So we've seen many of those requirements come forward in the last few weeks. Some that we can term draconian, but including school closures, banning of mass gatherings, more than 50 people, closure of our favorite restaurants or pubs or nightclubs. So it really will depend on how well we as a society adhere to what's being required of us, which is physical distancing and staying home as much as possible.
Right, thank you. Yeah, the closure of the restaurants impacts a lot of people. I understand that people on average spend 30% of their food time in restaurants versus eating at home. So this is quite difficult for restaurants, the business owners, the employees, but also maybe a challenge for people at home having to come up with more recipes. Or maybe it's an opportunity. I know I've lost a few ounces since this started. Mortality rates from the virus seem to vary from place to place. What's our experience in IH as far as mortality? Do we have any? And if we,
So we haven't had any
I
deaths
didn't
in,
think so, yeah.
and we look at something called the case fatality rate. And people will hear that reported out from our provincial authorities or federally or even globally. So the case fatality rate looks at the number of deaths over the number of cases of disease. And so we see some different estimates around the world from somewhere between 1% and 3% of those who have disease who die. But it also varies depending on what we talked about earlier. The elderly people and those with underlying health conditions will potentially have a higher case fatality rate.
Right. So here's one that very interesting. It might take a few more minutes to answer than one of the quick ones. What is herd immunity? Are we trying to get there in BC? If we don't achieve it, will the virus just come back and we'll have to start all over again? What about in the fall, September, when the kids go back to school? Will we see a second wave of COVID? So I'll just leave it there. Let's hear what your answers are, and we might have to go into supplementary on that one.
You might. So herd immunity, and that might be a term that is familiar to some people, but not in others. It's really when we have indirect protection of the population to a disease. And that requires that a large proportion of the population has immunity to that disease. And that's very important because it provides protection to those who are immune, and the more immune, the better. Those who are immune provide protection to those who aren't immune. So we call those people susceptible. Now with COVID-19, when this first came into our radar and into the globe in December, we can imagine that our entire global population was susceptible to this COVID-19. So there was nobody with immunity. And the way to actually achieve immunity is either by actually having the virus and then developing immunity to it, or through a vaccine. So this speaks to the importance of our childhood vaccines that we have that, for example, if children get the measles vaccine, if enough of them get them, then they protect those that can't get the measles vaccine. So what we're dealing with here is a situation where we have a very high, a population with very high susceptibility to the virus and low immunity. And of course, we're some months away from a vaccine as well. So it'll take some time to get to herd immunity.
So since we don't have herd immunity yet, and we are seeming to do a good job of self-isolating, and what we saw today, for those of us who did see Dr. Henry and Minister Dix's modeling, if we are successful in really bending that curve down, are we really looking then towards another outbreak later on? Because the virus will still be out there, and then we might start the whole process over again. That's I think what the question is really getting at.
Yeah, so it's important that we're through this time not getting too complacent and recognizing that we are going to see more cases here in BC. One of the purposes of what we call flattening or planking the curve is to buy us some more time, one, to prepare our healthcare system, but also to develop a vaccine. And so the physical distancing measures will continue for some time, and where we go with that will be, dependent on what we see the virus do, and obviously in consultation with provincial and federal authorities on that.
Okay. Yeah. How are frail seniors being supported in the community with the cancellation of adult day programs?
So we did talk a little bit about seniors that are in isolation and how we're reaching out to them and making sure that they have what they need, medications, etc. But a lot of seniors now are quite tech savvy and have iPads, and they can do FaceTime, etc. So I know a lot of families who are reaching out to their loved ones. They're deliberately staying away because they may have jobs that are deemed essential and their loved one is elderly. So they're communicating either through phone, through FaceTime, and trying to keep the social contact going for their loved one that way.
Okay. Someone from Elkford is asking about the latest scare between ibuprofen or Tylenol regarding the COVID-19. Any advice to them?
Yeah, I think David is Matt is still out. I know that at BC CDC and our provincial counterparts that they are certainly looking at the literature on that, but it's really too early to say.
Too early to say. Okay. The East Kootenay contains approximately 60,000 people. We've heard anecdotally that the East Kootenay Regional Hospital has 2 patients on ventilators due to COVID-19. How prepared is it to handle an influx of patients from not just Cranbrook and Kimberley, but from the surrounding rural regions as well?
So there's been a significant amount of work done in interior health. In fact, I'm super proud of the work that the teams have been doing. As you know, there was an announcement around elective surgeries and ambulatory type care. And we have managed to reduce our inpatient capacity to roughly about 60% today. And our ICU capacity is sitting anywhere between 50 and 60%. That allows us a lot of capacity from when you look at the worst case scenario, which was presented today earlier on the technical briefing. We are using that curve to really prepare for the worst, but we're in a very different starting position in the province of BC and in interior health. So for example, Italy's hospitals were sitting at roughly 110% when this hit Italy. We are sitting, as we've just described, almost at half our capacity, which allows us to be able to manage an influx if that should happen. And many of our hospitals can actually stretch to like 125%. So even if you take the worst case scenario, we've only got a small delta and we've had lots of retired people. It's great living in a place that people like to retire to. So lots of retired healthcare providers that are willing to come back. The colleges are re-registering people. So we feel that we would be able to expand our workforce to be able to accommodate as what we would need for worst case scenario. If we get into a situation where we think that it's going to not work by extending to 125% or even greater, we would go to extreme measures of potentially bringing in a field hospital.
So for example, in the Cranbrook area in the East Kootenays, would people move from the smaller hospitals into the Cranbrook Hospital as the center for anybody that has COVID, or would they stay in their smaller hospitals?
It really depends what happens with the virus. If it's sort of 1 or 2 people, they may choose to bring them more central to a site. And as you know, Cranbrook has a beautiful brand new intensive care unit. So they're well set up to look after this type of client. So it really depends how things evolve. But there may be the need to move some clients around if we get one pocket in one part of the health authority that is getting a bit more. We may try to move some people to allow that area to stabilize.
Okay. So under a different category, we have what action is IH taking to support CSIL clients?
So this is clients who live in the community where they have their own choices on how they would like supported. So they independently employ their person who works for them. So if they all have backup plans, they're all being looked at individually now and making sure they're sustainable. If CSIL is the acronym, if they got into trouble and didn't have somebody who could look after them, that's where we would look to deploy a previously retired registered nurse or somebody to help manage their care for them. And they're looking at different means on how they could use family members if in the short term that was desired, and also making sure they have the supplies they need.
Thank you. I feel, this one's a little longer, I feel like those of us with mental health struggles, have been left behind. Many of us, myself included, now have to wait longer for assessments and mental health services. All the IH buildings are now closed off and no longer offer group therapy. Nonprofit facilities like CHMA Wellness Center are closed. Counselors who already work with the most vulnerable are now being forced to cancel counseling sessions or have them over the phone. What can IH do to help?
Yeah, there's a lot of people who have mild to moderate mental health who actually manage that on their own day-to-day that may be getting into trouble or needing more help. So they should reach out to their primary care provider or their local health center, and we can get them hooked up to services. albeit maybe virtually, but service hasn't been removed. A lot of our psychiatrists and social workers and other community staff are doing their visits via video conference or telephone. So I don't want people out there thinking they're abandoned. They're not. If you're feeling extreme concern for yourself, there's always a crisis line where people could call 1-888-353-2273. Don't feel that you're alone out there. We will get you connected to people.
Thank you very much for that, Susan. To date, there seems to be a lack of direct and coordinated response from government for our loved ones who have disabilities, who often also have underlying medical conditions with compromised immune systems, putting them at great risk. Will the required additional resources to support people with disabilities and medical challenges who live in their homes and places of residence occur?
That's often maybe people who have chosen the community sports, like the previous example we talked about around CECL clients, or some clients that may have a brain injury or actually physical disabilities. Those that are known to us, we're actually reaching out and making sure that they either have a sustainable backup plan or making sure they've got the need and what they need to manage over the longer term. So lots of phone calls to people. If people are feeling they're not getting what they need, they just have to lift the phone to their case manager.
Okay, thank you. So the last part of the questions we got ahead of time, which I must admit around 5 o'clock today, I stopped looking at my email. I just couldn't keep up. But for those of you that did send questions after that, and for those of you who sent in questions on the live Q&A, the IH will endeavor to put up a Q&A sometime hopefully within a week, so we can get most of your questions answered. But in this section, it's mostly stats and resources, probably quick answers. How many ventilators are there in the Caribou Memorial Hospital at this time?
So right now there are 3 stationary and 3 mobile, but I do need people to know that there's been considerable planning done across the province and within Interior Health. So we can actually bulk up to almost triple what our usual ventilator capacity is. So there's been considerable work done in this area and we're feeling very well prepared.
Thank you. How many ICU units do we have at KGH and IHA?
So we have 3 units, which I'm assuming they mean actual pods where people are and not individual pieces of equipment.
Right.
That's our largest site. We've got our cardiac surgery ICU, and we've got A and B ICU, they call it, where different cases go. And then, of course, we can always use our operating rooms if we need additional ventilator space.
Do we have enough ICU beds, ventilators, and staff?
So intensive care patients tend to be the most labor intensive, if you would like, meaning sometimes they're a one-on-one nurse because they're fairly complex. So right now in Interior Health, we have roughly about 55 regular ventilated beds across the region. We have the ability to go to 150. That would include the use of some of our ORs and different spaces like the cardiac surgery ICU and our PARs, which is where people go post surgery for anesthetic recovery. So we also have provincially looked at purchasing ventilators, and the province is working with each health authority about any additional they need. And then we have been working with our secondary education facilities because they actually train people on ventilators. So for example, we just got word today working with Thompson Rivers University, and they're giving us 7 ventilators that they use to train people on. So there's been a lot of different partners coming together to make this happen. So we're confident we've got the equipment. And then, of course, it's a very specialized course to become an intensive care nurse. But we also have respiratory therapists who are trained in managing ventilators. And then we've got all the nurses that work in different areas, like, for example, the post-anesthetic recovery area, who are comfortable around those types of clients. I mean, we need to do a bit of a buddy system if we're redeploying some nurses to be an ICU nurse with a nurse of another discipline, so that they can take on maybe 2 patients under the ICU nurse's supervision. So, and then we've got physicians. So We've got retired people coming back online, so we will do the best we can to ensure through our HR planning that we're well prepared.
That's good to know, because we don't want to see hear what we see around the world in some other countries. It's very sad, of course, what's happening in many places in the rest of the world. Can you tell us, speaking of Kamloops, a question from Sun Peaks, can you tell us the critical COVID-19 care sites in IHA? I imagine there's two, Kelowna and Kamloops are the critical sites.
Is this
right?
for the testing of specimens? Is that what?
No, just says critical COVID-19 care sites. So I think Dr. Henry was talking about there's 19 province-wide. So how many are there in IH and where are they?
So definitely we would use, in Kamloops and Kelowna, we have our 2 tertiary care hospitals, and then we've got 4 regional hospitals in other areas. So Cranbrook, for example, Trail, Penticton, Vernon, and then we have a variety of other hospitals that have critical care capacity. So as we said, depends how the virus plays out, how many people are impacted, but all our sites that have ventilators are capable of looking after people.
Okay. What is IHA supply and access for all their facilities of sufficient supplies to deal with COVID, both for acute and long-term care facilities? I think what they're asking is, do you have enough supplies? And if not, what are you doing to make sure you do?
Personal protective equipment, we're calling it PPE, is obviously very important to make sure we're keeping our staff safe and those that we're caring for. So there's been a lot of work done provincially to standardize when you should use certain equipment and what's best practice depending what type of procedure you're doing. So that work has been done, and we work with the Provincial Health Services Authority, who are coordinating the supply chain, and they're working across Canada and outside of Canada to make sure they're getting the right supplies for us. What we call, for example, an N95 mask might not be the same standard as another country, so they're looking to see that we're bringing in things of the same standard and making sure we've got enough supplies to take us out through the following months. So they are working with different vendors and different suppliers now than maybe what we normally would, and coordinating all of that. And we're in touch with them daily on the supplies that we need in the interior.
So do you need help from locals in IH? One of the questions is that people are resourceful, of course, and they have some of them have some time on their hands. Do you need people to start pulling out their sewing machines or their 3D printers or any of that to help supply IH with the critical equipment that it requires? Yeah,
there's some real innovative things coming. So there has been some companies come forward that said they're capable of doing 3D printing. The challenge will be, does it meet the test of what we need in healthcare? So we've forwarded those offers on to Provincial Health Services, and they will investigate whether that meets the same threshold that we need. There's been other companies come forward that have offered supplies, like maybe from the building industry, cement plants, etc., that have masks. So all of that's been channeled into one section within PHSA to see what type of procedure that would be appropriate for. So the donations have been amazing, and we've been very lucky with the amount of people that have stepped forward.
Is there one best place to find information about the virus? Do you think we should go to this particular website or that particular site? Is there one best place to get information that is good, credible information?
There's a few, but the one I've been telling most people to go to, and I'll ask Dr. Pollitt to expand on this, is just the BC CDC. If you just type that in, those letters, it's the British Columbia Centre for Disease Control. The up-to-date information on that site is incredible, and it's very easy to navigate. But Dr. Pollitt may have some other ideas.
And I'm glad that you asked that, Norm, and we certainly want people to have the most up-to-date sources of information. And so we have a link through our Interior Health website as well for those who prefer to go local to some resources. And then the BC Centre for Disease Control, of course, is a great source, as well as the Public Health Agency of Canada. So some of the the things that we've talked about tonight, such as the quarantine orders, some of the testing strategies for laboratories, those can be found on the Public Health Agency of Canada. And the BC CDC website is great because it's very up to date, and you can go in. There's two tabs. There's one for the public and one for healthcare professionals, and so you can have a look there for hopefully get your questions answered. And of course, we have other resources as well. So there's a really great assessment tool that people may not be aware of, but it's the COVID self-assessment tool. So for those individuals who may be concerned that they've got some respiratory illness, or maybe they think they've been in contact with somebody with COVID, they can go online, and the link is on the BC CDC website. They can actually walk themselves through that self-assessment tool, and it will help guide them as to whether or not they need to call 811, seek care from their healthcare provider, self-isolate at home. So it's really useful, and it's been really well received.
Thank you. All right, so that's the questions ahead of time. Now we're going to get into the live questions. And again, for our viewing audience, thank you for joining us. So we've been at this for an hour. We still have another half an hour to go. Appreciate you registering. If you have registered, you can put in a live question in the Q&A box. Or if you're just watching, but you still want to get a question in, go to www.teamokanagan.com. Sorry to all the rest of the province that's watching. Yes, I use Team Okanagan. That's the website I had. So go there, and you could still register right away, and then you can put in your live question. If we don't get to your question, it's maybe because it was already answered previously in the last hour. We will produce a written transcript of this and post it up on my Facebook site in the next few days. So you can look through that and see all the questions and the answers. And other questions that haven't been answered, the folks from IH have endeavored to give us a Q&A in the next week or so, so that hopefully most of your questions will be answered. I've been wondering if there's a nasal antiseptic similar to that used on surgery patients that would help protect healthcare workers.
That's a great question, Norm, but that's not something within my scope of expertise. So maybe that's one we can get back to the public about.
Okay. How ready is Lillooet Hospital for the coronavirus with tests, kits, ICU beds, and respirators?
So as I mentioned before, we're really trying to equip the whole of interior health as one. So it may not be everything that's in a local site, but we absolutely would make sure people got to the definitive care that they require. So testing, as you know, is being done in numerous places, I mentioned earlier, across interior health. And the 811 number, if people are in any doubt, they should call or call their primary care provider and know whether they need to get tested. We have not got a backlog in our laboratory for tests that need to be done, so people should be getting those results in a very timely way.
The feds have passed pharmaceutical drugs for those in Vancouver's downside east side. When do you think locally that we can expand for our cities most vulnerable as well?
I think that's a relatively new, and so we'll have to work with our provincial counterparts on that to understand that a little bit better. But certainly we want to be in step with others in the province.
All right. How can I return to work without a test? I was exposed at the dental convention in Vancouver.
Mm-hmm. So for individuals who have had an exposure, in some cases it may be very appropriate for them to have an initial test to determine if they are COVID positive. For those who are self-isolating at home following an exposure, we talked about that 10-day period from onset of symptoms being the period of time where people need to self-isolate. After that 10 days is over, if they are feeling well, they have no more fever, their respiratory symptoms are gone, they can return to work, and that is based on our sort of most up-to-date evidence in terms of the period of infectivity of COVID-19. For those individuals who have more severe illness or hospitalized, then we look at a different, we may need to look at a different strategy. But for those who are self-isolating in the community, our recommendation is 10 days from symptom onset, provided they are feeling better.
We have an infrared sauna in our home. Is there any evidence that over 27 degrees would aid in killing the virus?
Mm-hmm. So it's so new for us, and I know we're hearing lots of questions about the virus and whether it's going to be more susceptible to heat or cold. So I don't think we have a definitive answer on that yet. And we just need to realize that we need to understand that that virus can live on surfaces for a few hours, or even up to a day or two, and we need to take the precautions during that time period. And I'm sure as we learn more about the virus, we'll have more information.
What is the sensitivity of the COVID test? I think they're looking for the rate of false negatives or false positives.
So just again, it's a new testing methodology, but our testing is very accurate, and my understanding, we have not had a high rate of false negatives so far. Yeah.
Okay. These are like the short snappers, right? In the debaters on CBC, right? This is like, we got so many, 241 questions given to us on live feed, 241, which I'll stop talking and just keep asking. How will it be ascertained when the coast is clear for everyone to emerge? I feel like hobbits right now. We're all stuck in our little hobbit homes. How does the provincial health authority know that the virus is no longer viable in our communities? I think those are two different questions. So.
Well, I think we all have that question, is when the coast will be clear, and it's certainly not yet. We're still in early days of this pandemic and of learning about the virus. And we know that we need to continue to follow the orders and recommendations of our provincial health officer. We're definitely not out of the woods, and those measures that we take now, even today, will really be important for what we see in our communities 2 weeks from now. So again, thinking about that 14-day incubation period, we need to think 2 weeks out. It'll be really telling in terms of how well we've been adhering to those physical distancing measures and other recommendations.
So another question that comes up, which says, I'm expecting my family will need to isolate until June. Can you provide guidance on this timeline, which is similar to the one I just asked? Best case scenario, is there a best case scenario that you can share with us as to if we do everything we're told and we're able to bend that curve down? Is there a best case scenario that you can share so people can be optimistic?
Well, we're going to need to rely on ourselves in terms of adhering to the measures that we need to be taking. So again, this is an all of society an effort, and all need to play a role in that. Can't provide a best or worst case scenario at this point. We rely on the expertise of those at BC Centre for Disease Control to help with that. But we've heard the term many times, flattening the curve. And that is really, when we talk about that epidemic curve earlier, we really want to see, we want to try and decrease the number of cases we see sort of at one time or in a sudden surge. That helps protect our loved ones, but it also ensures that our health system is prepared. So we need to stay the course where we are, and we need to not get complacent about the measures in place. All
right. Is there more than one strain of the virus right now?
Yeah, so it's interesting. One thing that has happened with the virus is they've done whole genome sequencing. So actually looking at the genetic makeup of the virus, and that enables us to tell what sort of strain is circulating. And I think early days of this pandemic, or when this virus first came into BC, we were able to tell that the strain we were seeing was likely the one that was circulating in China. And now we're seeing more commonly the strain that would be circulating in the US.
Can you explain why, when in normal years, the death toll of influenza in Canada is around 3,500, why we are declaring a pandemic this year when this time COVID-19 has caused 345 deaths in Canada so far?
Well, we can look back to the origin of COVID-19, and so we know that this was an event that was likely a spillover from animals to humans back sometime in 2019. This was a virus. This coronavirus is one that circulates likely in animals and not in humans. So this was a brand new virus for humans, and as I spoke before, that we have an entire globe of people who are susceptible to this virus. So we don't have an effective treatment right now, and we don't have a vaccine for this. So that really puts all of us at risk, and especially our loved ones who are in the higher risk categories, the elderly, as well as those with underlying health conditions.
Thank you. We've just returned from Europe. Nice. March 15th, and voluntarily self-isolated. We are almost at our 14 days. will it be okay for us to practice social distancing and go for a walk with our family or even a friend afterwards?
So provided that that 14-day period is completed and individuals have not had any symptoms, certainly we do certainly want people to go outside, whether that be in their backyards or front yards, or to take a walk, provided that they can maintain the physical distancing. But right now, we really need to focus on doing those activities outside with our immediate family members that we live with, because we need to protect others around us, even our friends. And so for right now, we need to, as much as possible, stick with our family and our close household contacts. But we also need to get outside. It's true, we need to get outside for our physical and mental well-being too.
So are you saying there that if you're living in a home where you've been isolated for 14 days, when you come out of the basement or wherever it is that you've been isolating yourself, if your family doesn't also live in that home, or if your friends also don't live in that home, you should not be going closer than the 2 meters to them?
We should really be trying to maintain that physical distance with others, even those in our household, but certainly others outside of our household as much as possible, because of the nature of spread of this virus. And again, we don't know necessarily about the health conditions of other people, and to prevent transmission between individuals, we need to maintain that 2 meters or 6 feet.
Right. I know my wife and I have been doing that here. The kids come to the house and we talk to them through the window. It's hard to give hugs that way.
People have been using different means of communication now, right? So we talked about physical distancing, but social connection. And so we certainly, in 2020, we have a lot of opportunities to connect virtually, like we're doing today. Even Susan and I are in different rooms today, and we can do that with our family members and friends as well.
Given what we saw developing in Hubei and Italy, when and how did we start preparing for this pandemic in Canada and BC? I would say over 100 years ago from our conversation before, but specifically on COVID, when did we start really ramping things up?
Well, the health authorities always prepare for different types of influenza every single year. And we have had a pandemic plan in interior health for years, and recently just revisited that last year and refined it. So we were in good shape for the worst, if you like. So the plan has really helped guide us and get us prepared to where we are, and working provincially has really been an advantage to this health authority. And I think to the others, it's allowed us to go in lockstep, which has helped prepare the whole province, because obviously it's not very helpful if one health authority is way ahead of others. So we're all at the same stage, and we're all in it together.
So based on the plan that you do have, and you said you had it and you've exercised it, adapted it, changed it over time, of course, like any other plan. We've been following it and slowly getting into isolation. And I would say one of the biggest questions or comments I got on Facebook in advance of this is, why aren't we all locked down already? What's taking so long, kind of thing. And there's a good reason. And if you want to discuss that, that's fine, as to why things have progressed, in increments, as opposed to day one, poof, everybody's locked up and you can't go get food, that kind of thing. But what does your plan tell us on the outside, on the exit? What does the exit look like according to the plan? I assume it's not day 62, boom, we open the doors and everything's back to normal. There must be some kind of incremental, again, exit strategy. Can you share that with us?
So once our physicians and experts have said it's safe to resume normal activities, etc., I assume we'll have some people left in the health system that still need some care. But we will be looking to normalize the healthcare system as soon as possible. Obviously, taking the extreme measure to take down elective surgery was a very difficult decision for the province to do, because there's a lot of people out there who require surgery and needed ambulatory care procedures. Even though they're elective, some people are in pain. So we will want to resume activity as quickly as possible. So if there are still some patients with us who have ongoing symptoms, we would look to cohort them and try and get the rest of the system back up and running as quickly as possible. Depending how long this goes on for, and and what our workforce is like. Obviously, we want to give our workforce their vacation, etc., and keep them healthy and safe. So it will depend on the length of time and what month this ends up being declared over.
Right. A lot of our viewers live on a border with the United States or a border with Alberta. So here, I think that's what's prompted this particular comment. I'm not too sure it's a question, but I'll just read it to you and get your comment on it. We are not following Alberta in protecting healthcare workers and patients. And this is BC, right? Not IHA. Because the COVID-19 test has low sensitivity, approximately 50% false negative rate, Alberta healthcare workers showing symptoms are required to self-quarantine for 14 days, regardless of the test results, so as not to potentially infect in hospital patients who, by the mere fact of being in hospital, are immune compromised already, or fellow healthcare workers. In IHA, if you are showing symptoms but test negative, healthcare workers are to return to work. So can you provide some comment on that, please?
Yeah, so in terms of when healthcare workers can return to work, we do have lots of conversation about this at the provincial level with my colleagues and with Dr. Henry. We also have experts at BC Centre for Disease Control who are combing through all of the literature that's coming out, and there are many studies coming out from other parts of the world as we learn about this outbreak and continue to learn about this virus. And so right now in BC, our recommendations for when healthcare workers can return to work, if they are, and I'm assuming that this is if they are a confirmed case of COVID, is the same recommendation that we have for other individuals, non-healthcare workers who are confirmed COVID cases. And so the recommendation is that from 10 days from the onset of symptoms, provided that they are feeling better, that they can return to work. So we are like I said, learning, and we do follow provincial guidance on this.
Can I just encourage you to really be sensitive to the people on the border with Alberta. There's a lot of angst about Albertans coming over and not following the same rules as everybody here, and that, well, not everybody, but the rules that we do have here, and people are worried and concerned, and I hear that quite often on a daily basis from my colleagues along the Alberta border.
And Norm, is that people who are coming over for work or other reasons?
Other reasons. They have they have a second home in Invermere or wherever, right, in the Shuswap, and they I've been told, I don't have firsthand experience because I'm in my room, that they are not following the same self-isolation practices or distances or not getting together in groups, the same kinds of things we're doing here. So I don't know for a fact if it's Albertans or it's just people from other parts of the country. Could be anywhere, right? So at the end of the day, I'm just suggesting that we take very seriously everybody that's not following the rules and have a way to make sure that they know how serious it is, so that they do follow.
And we do expect visitors to BC or non-residents to BC to follow the same direction that our BC residents do. And just maybe I'll speak briefly to some of the what may or may not be discrepancies between BC and other provinces and territories. There is also a group that meets regularly of the provincial health officers for the provinces and territories with our Chief Public Health Officer for Canada, Dr. Teresa Tam. And so that group is meeting regularly as well to talk about coordination and standards.
Okay. So we'll move on to a different topic here. Yes, still COVID, sorry. Vulnerable and marginalized members of our community are at high risk. Some of them don't even have access to public washrooms or showers, of course, housing. And some of our cold winter shelters are closing down now. What do we do to help these people so they don't all congregate in one place and then start passing on the infection between themselves and, of course, to the general public?
We have been working with some of our partner agencies around when, for example, a street entrenched person did display symptoms or needs additional help, such as Salvation Army, and they've been assisting on spots on how to self-isolate and provide care for those individuals in between time. And we do have outreach teams that know those who are most vulnerable and are often in contact with them either through phone. Some of the street entrenched population do have phones, and they can reach them that way, or they know how to contact our outreach providers. It is challenging. They've had a challenging winter. It's been very cold, and they know how to get in touch with people. And the shelters are still physically open right now, so they have been working with us. So once they start to close down, of course, we'll need to make sure we have got additional areas that we could self-isolate people.
So they're getting access to information. I've had the privilege of volunteering at the Welcome Inn, for example, in Kelowna, and in from the Cove before that. I see a lot of them with cell phones, getting, checking out all kinds of stuff, but not all of them can afford the cell phones or carry them. So those that can't, they're getting information through what source? How are they getting supported?
So obviously, through their own network, often they talk. I have worked with the street entrenched population before in Vancouver a long time ago, but they have substantial networks on how to share information amongst themselves. And they're actually quite knowledgeable about different things going on with their own health, how their street drugs, if they're using substances, how they interact with other medications that they may be taking. And so they also look out for each other. So there's different ways of getting there. And of course, our outreach team in Interior Health know who's most vulnerable within that group.
Right.
Can I just add into that?
Yes, of course.
Thank you. So we also have a group within our EOC, Emergency Operations Center, that is focusing on vulnerable and marginalized individuals. And I know that our medical health officers have been in contact with BC Housing as well, to see how we can support these individuals. And as well, if there's a situation where we did need to isolate somebody who didn't have access to housing, then we would work very closely with the individual and with BC Housing and the shelters to find suitable accommodations in the situation.
Okay. A friend of mine was told by an 811 nurse that the virus is not spread unless you are experiencing symptoms. Is this accurate?
Mm-hmm. So we talked a little bit earlier about asymptomatic transmission, and so like I said earlier, we think and we believe that the majority of transmission occurs from symptomatic cases, and we're still learning about a little bit more about asymptomatic transmission. But the numbers that we're seeing now in BC, as we follow this outbreak, are largely driven by symptomatic transmission.
A lot of volunteers in our communities around BC and in the interior are seniors. So this is a very, very timely question. I'm well over 60 years old. Should I and my fellow aging volunteers who are offering to shop and do errands for others actually enter stores and public places?
So even within the healthcare system itself, we have a large network of volunteers who are on our sites every single day. So what we've chosen to do is let them make the decision if they want to. If they feel vulnerable, then obviously it's not expected of them to continue on. But if they're taking similar precautions, and there's lots of ways you can support people without even seeing them. If they want to leave groceries at the door for somebody or do an errand for them, they don't even have to be around them. So it's a bit of a personal choice for some people. It may be dependent on if they've got underlying chronic disease that puts them more at risk. And for others, as I say, it might not put them at risk at all.
Is there going to be a second wave?
Yeah, that's a question we've been asked a lot. So I think that's certainly a possibility. But right now we're in the first wave, and like I said, we're still in sort of early days of the first wave. I think that question comes up is because for example, in influenza viruses, we often see a peak of those viruses sort of over the winter and then sort of petering out over the summer, then back again in the fall. So I think that's where that question comes from. So we don't know yet if we're going to see a second wave, but I think we need to prepare for that.
Why aren't hardware stores, BC liquor stores, grocery stores doing better job at demanding social distancing from customers? I'm shocked at how many family members it takes to push a shopping cart.
I think initially it maybe wasn't as stringent, but I know some of the stores now have gone to great lengths to try and ensure that social distancing occurs, even with having people line up outside with lines that are 2 meters apart. And then when they get into the store and do their shopping, that when they go to the cash register, there's no lineup at all. So I think some of the stores and businesses have done a really good job at trying to make best effort at social distancing. And for those where it's not that obvious that they have, we also have an obligation to ensure that we know what we're supposed to do. So we need to be conducting ourselves in that way.
So this one will be a little more of a challenging question. I apologize ahead of time. You can send me nasty emails afterwards, but the question is from an anesthesiologist at Royal Inland Hospital and says, we are told not to treat everyone as having COVID to limit the use of PPE. So the reason why I say it's a challenging one is, why is this anesthesiologist coming on to this webinar to ask a question or to make a point? What is the communication that IH has with its own team of medical experts? What's in place so that people like this won't be asking questions here? They're certainly welcome to do that and make comments, but I would think that the communication that you're having with your staff would address this issue. So can you comment on that a little bit?
Yeah, absolutely. We've got a pretty robust group of executive medical directors and our vice president of medicine and quality, and the chiefs of staff at the site are very present every day. And to my knowledge and everybody else's knowledge that's working on this, we have not said do not treat people with COVID. Of course, we would treat people with COVID-19. That's what we're here for. We are the healthcare system for the people of British Columbia, and anybody that comes through our doors that's in need of our services will receive them.
Is it safe to be in the yard of a multifamily property shared with others, shared laundry services, that kind of thing?
Mm-hmm. Well, sometimes people don't have another option, right? And so again, being in a shared yard can be a little bit challenging if there are young children involved, because of course it's hard to keep children tethered to ourselves and keep them 6 feet or 2 meters away from others. And so I think that families who are in those housing situations need to be innovative and creative, and maybe they decide that they're going to have allocated times in the yard. But certainly, if they're out there, they need to be maintaining that physical distancing.
Even if you're immune compromised, it's okay to go outside as long as you maintain that distancing.
Mm-hmm. So, and we want people to as much as possible remain inside, but of course, getting outside is important for us, for our well-being. And so the key is the physical distancing.
Okay. If you've been exposed to COVID and are now clear, in other words, you've done your 14 days, are you immune?
Mm-hmm. So we're learning about immunity right now, actually, as we are starting to see people who have recovered, and we've seen a number of people now in BC who've recovered from COVID, which is very good news. And we know that there is immunity to COVID. What we don't know is how long that immunity will last, but we think it'll be long enough to get us through this pandemic. And so the one thing that we can think about is healthcare workers who develop COVID and recover from that they can then come back into the workforce and maybe feel a little bit more confident about working with COVID patients, provided they have the appropriate personal protective equipment still.
Okay. If we're staying at home and feeling fine, do we have to keep washing our hands and disinfecting?
Mm-hmm. Well, I guess we never know what our other family members might have, and I think it's just good hygiene and good practice to be keeping our household surfaces clean and be washing our hands. We're still actually very much in influenza season as well, and I think sometimes we forget that. But we've had a bit of a late influenza season for us in BC, and so we have that on top of the COVID, and so there's other viruses that are circulating, and again we know that our more vulnerable are susceptible to those viruses as well.
Is it true you could be shedding the virus for up to 5 weeks?
Mm-hmm. So that's a really good question. And I think that also maybe comes from the fact that sometimes we can, if somebody is swabbed, has a nasopharyngeal swab, after recovering from the virus, there may be There may still be some genetic material that's retrieved from that swab, but that is most likely to be dead virus. So not in a situation where they'd be transmitting to others at that point.
Is there a typical way in which symptoms of the virus appear?
Well, everyone's a little bit different, like many of our diseases, and we're all very different people. But this depends on the individual. So this virus can present in a very, very mild fashion. We've had individuals who've only had reported only, some runny nose for a couple of days. And then we have other individuals, as we know, who get very, very severely ill. The sort of the three things we think about with COVID, the three symptoms we look for certainly are fever, cough, and shortness of breath. But there's other more typical symptoms that we see with other respiratory viruses that can also present, such as headache or aches and pains, sore throat. So it's quite variable.
Okay, and the last question, because we've done our 90 minutes. Before symptoms appear, is coronavirus contagious?
So I think that speaks again to a bit of that transition before somebody's symptomatic. And we really think that people are most symptomatic most infectious when they're in that symptomatic period.
So I'd like to thank you, Dr. Pollock and Susan Brown, CEO of IHA and president as well. Can't forget that one. Dr. Pollock, the Chief Medical Officer for IH, for coming on and answering many of the questions that people from around the IH area have submitted. Just to remind people that are watching, these questions that will be provided to IH, and those questions that haven't been answered tonight because we ran out of time, in the next week or so, they'll put up a Q&A and hopefully cover most of your questions. We'll also take the video that we have from tonight's recording and get it transcribed through one of the online apps and put that up on my Facebook site. And again, I would just want to give a big shout out to all the MLAs from IH who shared the word, and all the media who shared the word of having this tonight. It's very welcome. For those of you that are in the School District 23 catchment area, we're going to have Maura Baxter, the chair of School District 23, and Kevin Cardall, the CEO of School District 23, on Tuesday night, right here. In the next day or so, you'll be able to register for that virtual town hall. So stay tuned for that information. You can do it right at teamokanagan.com. And again, to all the people that are taking care of us in healthcare, in services like our grocery stores, delivery people, what we would do without delivery people right now, delivering packages. To all of you, thank you so much for putting yourselves out there for the rest of us. And for all of you that are inside, breathe, take a breath, take care of your mental health, and please be with us in spirit and in healthy bodies for the time to come. So with all that, thank you very much for joining us. Again, to both of you, Sue and Susan, appreciate you coming on, and everyone, good night.
Thanks.